everyone, my name is Bryanna Testino, and I'm a third-year cell and molecular biology major planning to graduate in the spring of 2023. For my CanCare co-op project, I studied sustained release of an ovarian cancer therapy via a biodegradable implant in the Dinilescu lab at Brigham and Women's Hospital. Ovarian cancer is the fifth leading cause of cancer death among U.S. women, in addition to being the deadliest gynecologic malignancy. There are three main types of ovarian cancer: epithelial, germ cell, and stromal. My project specifically focused on high-grade serous ovarian cancer, which is a type of epithelial ovarian cancer. High-grade serous ovarian cancer is regarded as the most common and lethal type of ovarian cancer, accounting for over 60% of epithelial ovarian cancers and 70% of all ovarian cancer deaths. Ovarian cancer often lacks noticeable signs and symptoms in the early stages. As a result, most cases are diagnosed in the distant stage once there is already widespread metastasis throughout the peritoneum. Unfortunately, it is at the distant stage that the 5-year survival rate is the lowest. While we must keep developing novel methods for early detection, we must also improve upon existing therapies for the disease. Currently, PARP inhibitors are the most effective maintenance therapy for BRCA-deficient cancers like breast and ovarian cancer. Under normal conditions, the PARP enzyme plays a key role in repairing single-strand DNA breaks using the base excision repair pathway. However, if the PARP enzyme is inhibited, the single-stranded DNA breaks propagate into double-stranded DNA breaks. These double-strand breaks then rely on other methods for repair, such as homologous recombination, which requires functional BRCA1 and 2 genes. Patients carrying BRCA mutations therefore have defective homologous recombination pathways, which causes these double-strand breaks to be repaired using lower fidelity methods like non-homologous end joining, and ultimately results in cell death. The current standard of care for PARP inhibitors requires women to take multiple pills a day. Hence, the Sridhar lab sought to develop an implant that can provide sustained PARP inhibitor release over a 3-week period to improve the quality of life for patients. The Sridhar lab created the InCeT-TLZ Spacer, which is made of biodegradable polylactic coglycolic acid, or PLGA, and loaded with 0.5 milligrams per kilogram talazoparib, a potent form of PARP inhibitor. Talazoparib is hydrophobic in nature and is often taken orally, which can significantly reduce the bioavailability of the drug. Patients are therefore required to take high doses of the drug, which can cause off-site cytotoxicity. However, the InCeT-TLZ Spacer allows for sustained and localized delivery of talazoparib as the PLGA degrades. A previous study performed by the Sridhar lab found that the InCeT-TLZ Spacer is more effective in inhibiting tumor growth and less toxic in immunodeficient models compared to free talazoparib, which was administered via oral gavage. The objective of my project was to determine whether sustained talazoparib release via the InCeT-TLZ Spacer inhibits tumor growth and prolongs survival in immunocompetent models. To do this, I followed the displayed treatment plan. There were 3 treatment groups: blank spacer, free talazoparib, and the InCeT-TLZ Spacer, with 5 mice each. The mice were inoculated on day 0 with 5 million BPPNM cells. The BPPNM cell line used models high-grade serous ovarian cancer with conditional BRCA, TP53, P10, and NF1 deletions, as well as MYC overexpression. Treatment began on day 7, and the blank and InCeT-TLZ spacers were implanted into their respective groups, and the free talazoparib group received their first dose via IP injection. The free talazoparib group was treated 3 times a week, and the spacers were implanted every 25 days, over a 48-day period. Prior to beginning the experiment, an MTT assay was performed to determine whether the BPPNM cell line responds to talazoparib in vitro. The BPPNM cell line had an IC50 value of 4.7109 nanomolar, indicating that it was highly sensitive to talazoparib. Survival data was recorded over the course of 48 days. A statistically significant increase in median survival was observed in the InCeT-TLZ group compared to the blank spacer and free talazoparib groups. As you can see in the table, the InCeT-TLZ group had a median survival that was 12 days longer than that of the free talazoparib group. Overall, the findings of this study show that the BPPNM cell line is responsive to talazoparib in vitro, and that localized and sustained PARP inhibitor release via the InCeT-TLZ spacer prolongs survival in immunocompetent models. As for future directions, PARP inhibitor has been shown to increase PD-L1 expression. Thus, adding anti-PD-L1 immunotherapy may enhance the efficacy of the InCeT-TLZ spacer in treating BRCA-deficient cancers. We also plan to analyze blood, ascites, tumor, and organs that were collected from the study cohort. Lastly, we will determine the IC50 of the murine collected to determine whether the spacers cause PARP inhibitor resistance, which is commonly seen in patients. I am so grateful for the experience that I have gained as a CanCare co-op student. During my co-op, I learned valuable technical skills such as cell culture, mouse handling, microscopy, immunostaining, and academic writing, all of which will prove useful in future research positions. I also experienced professional and personal growth. I strengthened my communication, organizational, teamwork, and critical thinking skills. I also became more confident in my abilities as a scientist and solidified my interest in women's health. Going forward, I will continue to work in the Dinilescu lab per diem while in classes this semester. I will also be working as a health equity intern to gain exposure to public health research. I would like to thank Dr. Siddhar, who is the director of the CanCure Nanomedicine program, as well as my CanCure mentor, Shi-Chang Yang, who is a PhD candidate in the Siddhar lab, Dr. Van de Ven Maloney, who is the assistant director of the CanCure Nanomedicine program, Dr. Dinilescu, who is the principal investigator of the Dinilescu lab, as well as my day-to-day mentor, and finally, Alan Green, who is a research technician and my co-investigator in the Dinilescu lab. Thank you.